Hi there again, everybody. This is Dr. Rob Lindsay with our autoimmune treatment success number 7, blood sugar or blood glucose. Now, from a medical standpoint, normal blood glucose levels have a broad range of 70 up to 105, while functional or optimal blood glucose level ranges are 85 to 99. Now, according to the American Diabetic Association, a blood sugar level of 106 to 126 is termed insulin resistance or prediabetes, and anything above a reading of 127 is diabetes. Granted, those are fasting blood glucose levels, and it's important to note that because many times I'll see patients who have been tested, and I'll ask them if they fasted before their test, and they'll tell me no. So you need to at least have 12 hours of fasting, which means no food at all, no orange juice, no coffee, nothing except plain water for 12 hours before you get tested. Okay? And that's the only way you're going to get accurate blood glucose levels. Supporting an autoimmune disease or hypothyroidism is futile if your blood sugar level is too high or too low. A reading below 85 would be termed hypoglycemia, and a reading above 99 would be termed hyperglycemia. But in general, this is called dysglycemia, and this is a stepping stone to diabetes. Diabetes is becoming so prevalent in the United States that authorities are predicting that it may bankrupt the healthcare system. Hypoglycemia is a condition in which the blood sugar level repeatedly drops too low in response to a high carbohydrate food. Refined sugar is a good example of a high carbohydrate food. Hypoglycemia can also be a result of going too long without eating, and too many Americans are skipping breakfast, and you've got to eat breakfast, and it has to have protein. It's important, if your blood sugar is below 85, that you eat every 2 to 3 hours. You should have a breakfast, a snack, lunch, a snack, dinner, and a light snack before bedtime. Now the snack could be vegetables, fruit, nuts, and or seeds, but it should be something healthy. Now, insulin resistance is high blood sugar that hasn't yet reached the point of diabetes. It's called prediabetes, and it's a result of the cells becoming resistant to insulin, so that no glucose can enter the cell to make energy. Now, you need glucose in your cell to make energy. It's vital. It's critical for life. And your brain and nervous system need two things to survive. Remember, we said you need fuel and activation. And fuel comes from oxygen and glucose. So you see, glucose travels in the bloodstream until it's turned into triglycerides or stored as fat. This is why it's important to monitor triglycerides as well as glucose. Now, the process of turning glucose into triglycerides demands an increased amount of energy, causing you to feel tired after eating. So, when you're eating a high carbohydrate diet filled with white bread, pasta, and refined sugar, you can't keep your blood sugar levels stable. If you feel sleepy and or you crave sugar after eating, you know that you just ate way too many carbohydrates. And if you feel sleepy after a low or no carbohydrate meal, you're most likely insulin resistant. It's literally impossible to support hypoglycemia or insulin resistance unless you eat a healthy breakfast with ample high-quality protein. You need to eat protein in the morning, not carbohydrates. You need to eat eggs. You need to eat lean meat such as turkey, chicken sausage. You need to eat protein in order to support your blood glucose levels. Even if you feel nauseous first thing in the morning upon waking, eating breakfast is critical, and eating a breakfast of high protein will most likely relieve your nausea. And finally, if you have hypoglycemia, you should never fast. It will make matters much worse. Okay, so this is a critical piece of managing autoimmunity or any healthcare issue. Don't suffer another minute, folks, and give us a call. Think we can help you. 952-949-0676. Again, this is Dr. Rob Lindsay at Vallejo Health and Wellness Center. I look forward to seeing you on our next Success Secret.